intelligence as I have. Thank you, Dr. Redletter. But at the debate in New Hampshire in January, which ABC sponsored, it was very proud that one of its reporters had snuck in 2 suitcases full of potentially dangerous material, one through the port of New York and one through the port of Long Beach in California. And we still don't know what is coming in to our country, as well as not knowing who is coming in to our country. That's a very serious security issue. If this administration has not fully funded the bipartisan September 11th Commission report recommendations around what we do need to do to better protect our port security, our airports, our borders, and when it has chosen to fund certain aspects of the recommendations, it's done so in a way that is not responsive to our local community needs or realities. At the debate at the University of Texas, a little bit more than a month ago, my mother talks about how she'd been at the University of Texas at Brownsville campus. Brownsville is along our southern border, and the wall that President Bush wants to build along our southern border, in its current proposed form, would cut in half the University of Texas at Brownsville campus. Can you imagine if someone cut your campus in half here? And after this conversation today, to go back to class or to go back to your patients, you had to walk through a border checkpoint. We know that we need to be doing more for our security, but we need to be doing more for our security that relies more on technology and people and takes extraordinary steps like building a wall only when we have to and only after having talked to local communities and done environmental impact studies so we really know what we're doing. But we also need to have comprehensive immigration reform. And my mother has said that we should invite out of the shadows the 12 to 14 million people here illegally. We should register them. And if people have committed a crime in this country or their home country, they'll be deported. But if they, like the majority have been here contributing to our economy, they'll pay a fine for coming here illegally. And if they haven't been paying taxes, they'll have to pay back taxes as a percentage of their income going forward. So that they are supporting our healthcare system, so that they are supporting our public school system, they are supporting their local police departments. And then they'll have to stand in line behind people who came here legally on a path to earn citizenship. And simultaneously, we also have to crack down on employers who are exploiting undocumented workers. And that's not good for the people being exploited, obviously, but that's also not good for Americans who are competing on unequal wage expectations or unequal labor and environmental health and safety expectations. And then there's also a trade component to this. My mother has said that we should have a moratorium on new trade agreements so that we can open up the trade agreements that we have to see what's working and what's not, and renegotiate what's not working. Now that's partly about better protecting our workers here at home and better protecting our public health here at home. But it's also about standing up for our values and recognizing that public health and better working conditions are important, whether it's in the United States or somewhere else. That over time will help create better jobs in our trading partners. And that will ensure that fewer people come to our country. When people don't come to leave their families, they come to work. And if they had better options at home, they would take those. That's in our long-term interest also as Americans, so that we're again articulating our American values more clearly around the world than we have under this administration. But your question also is an important one, because we know that until we really know how many people are here, and we're ensuring that people can participate in the healthcare system, we're ensuring that we understand how many kids might show up to kindergarten next year, we'll never really be able to right-size funding or programs to ensure that we are guaranteeing everyone the right to quality affordable health insurance or every child the right to a quality public school education.